Um, I just want to say, first of all, I really appreciate both you, Dr. Amjad, Dr. Marsh, for joining me today, taking time out of your schedule. And I'll note too, one of the things, and for those of you that don't know me, I'm Wilson Harvey. I always call myself Mr. Harvey. I'm an educator, so I'm used to that nomenclature. But um, one of the things that has impressed me and a lot of other people that I've talked to from the beginning of this pandemic is the communication and your all's willingness to communicate um, throughout this situation has been commendable on Twitter and doing things like this and the briefings. So I just want to thank both of you for that. I'm sure it takes away a lot of your free time.
It's all great to be of service is a privilege, and we appreciate all of the questions and the input that you provide and other people too. It's really important that we understand what people are thinking and we've gotten a lot of good suggestions during this time, which seems like it's been forever, but has been less than a year so far.
It sure does. It sure does. I think there's, as well as the communication has been, I think there's still a lot of folks that have questions. There's still a lot of confusion, and there's a lot of things that folks want to know. And so I'll dive just sort of right in. I'm curious, um, in a broad sense, we're entering, yesterday, Dr. Marsh, you talked about how some of the darkest days might still be ahead of us. I hate to start on an ominous note, but with both these, as we enter these winter months, and I saw, today we reported another 23 deaths. What would you say is your biggest message in a broad sense to West Virginians in this critical time period?
Well, I appreciate that. And I'm Clay, by the way. We talked about that earlier, but I would just say that, right now, we know in the US and in West Virginia, we're seeing more new cases on a daily average than we've seen before. In West Virginia, we're approaching 1,000 people a day newly diagnosed. In the US, we are in the neighborhood of 150 to 175,000 new people a day. More people are hospitalized in the US and in West Virginia than ever before, and that includes inpatient hospitalizations, ICU hospitalizations, and that's despite our knowledge about how to treat people better, how to prevent disease better and transmission. And the governor is, and we are all very excited about the rate of speed in which vaccines are coming to at least be up for Federal Drug Administration approval. But we also recognize that those vaccines will take a while to really distribute and to be produced in volume sufficient that enough people will be vaccinated that will be able to go back to more normal as opposed to what we have today. And I think that it's a reasonable estimation to consider that we will be mid to late 2021, maybe even through 2021 before we have really everybody vaccinated who wants to be vaccinated. And I think that brings up a really important issue is that a lot of people are very concerned about vaccinations. And we know from a public health perspective, that is the single most important intervention that we can make to save lives and reduce disease burden after clean water that is reasonably available. It's still an issue in the world. So I think that the issue for us, Wilson, is to have people continue to focus on being great neighbors and to being, service-oriented folks from West Virginia. We've always been the people to serve. We've served the world wars. We mined the coal under the ground to build the Industrial Revolution. And I think we're calling on that service mentality of our citizens once again, because we know that the truth is that we each have the ability to stop the COVID-19 virus in its tracks. And that becomes our willingness to wear masks and stay physically distanced and to avoid big crowds of people, indoor environments, particularly those where we take our masks off to eat or to socialize or to drink or whatever, and also to try to avoid being close to people 6 feet or less that you don't live with all the time. and that's a cumulative 15 minutes, less than 6 feet over a 24-hour period. So I think if we are able to do those things as the vaccine becomes available, or vaccines, because we believe that several of these will be approved, then we will have that opportunity to reduce deaths, to save lives, to facilitate well-being, but also really protect our vital healthcare assets. Because what I'll finish saying is that 2 to 4 weeks after we see more new cases is when we can reasonably expect to see more hospitalizations and more people die. And this has been the trend that we've seen across the US, as more and more people have been diagnosed with infection and spread has increased, then we see more hospitalizations, et cetera. The Thanksgiving holiday had the highest mobility data that we've seen since the beginning of the pandemic, and that is inclusive of West Virginia. So more people traveled, more people went to visit other people during this holiday than we've seen so far. And predictably, 2 to 4 weeks after that, those connections that people made with each other, we will likely see more hospitalizations, more sick people, more people diagnosed with COVID-19. And that's the reason why I made the comment that I'm worried that darker days are coming, because predictably that's what happens. That's what we've seen happen. That's what we presume will happen in the future. And unless we really get on top of this as a state and really start to double down and do this as a way to care for each other, then we're going to be in trouble, because our hospitals are filling up, and our hospitalized patients need really sophisticated care. A lot of them, they're really sick. But also our hospital staff are getting infected in communities the same way that other people are. So I think that this is a really critical time for us in West Virginia and for us in the United States, as well as the rest of the world.
Mhm. That's a lot of great points, and it is a very grave situation indeed. There's a couple things I'll come back to in a bit, but Dr. Amjad, same question to you. What would you say at this moment in time? What would your message be to West Virginians?
Well, I mean, going along with what Clay was saying, West Virginia is not any different than the rest of the country. What we're seeing, we're lucky in the sense that we don't see as high numbers as some of even our surrounding states. Ohio, Kentucky, Pennsylvania are seeing, I think, anywhere from 3 to 7 times the numbers that we're seeing. And we've done really well with keeping our numbers lower than that. So I think it's a shock when West Virginians see, 1,200 a day, 1,300 a day, but we have to remember that it's a surge across the country, if not the entire world. So we have to remain vigilant with what we know works, which are masks, which is socially distancing, staying away from things, crowds, and places we know that transmit the virus. And it is holiday seasons tend to have these surges. We saw it after July 4th. We saw it after the September weekend, Labor Day weekends. We do expect it after Thanksgiving. We did see it after the October 30 Halloween episode as well. So as Clay mentioned, these are the times where people need to be vigilant or strong about the stuff that we know works. It's hard because Thanksgiving is a time of family celebrations. Christmas is coming up. Those are the times we want to be with our family members. But people need to remember, when you get sick and you go to the hospital right now, you don't get to see your family member. You're not allowed in there. You're not allowed with your loved one. And that should get to your heart right now, that you can't be there with them when you're sick with COVID right now. And to me, even as a person and in medicine, and Clay can relate to this, and as much ties as we have, we couldn't go in easily, so that, to me, I wouldn't want to go into the hospital right now. I wouldn't want to send my mother into the hospital right now. So people need to remember that we do these things for the people we love, the people around us. And that's why, you'll hear Clay say altruism a lot. You'll hear people say, do it for your neighbor, do it for your loved ones. Because even though I might say I'm healthy, I'll get over COVID, we really don't know. So you hear us saying those things a lot because as healthcare providers, we know what goes on behind closed doors. Cameras are not allowed in the hospital system. But being a practicing physician, and Clay as well, and seeing a lot, we know what happens behind doors, and it's not something people want to see. So that's what I would remind people, that you're not allowed in the hospitals with your loved ones.
It's a pretty, it's a pretty stark reminder. And I
Hey,
think,
hey, Wilson, let me make one more point if I can, just
yeah,
off of what Ayne said. You know, one of the, I think the great misconceptions that at least I believe is true is that somehow this is a, you know, a reduction of personal liberties or personal freedoms. And, you know, and people state all the time, well, you know, these things aren't working, we need to do more. But the real truth is, this is not something that can necessarily be governed. This is something that we have to choose and decide to do. And eventually, when this story is written, it's going to be written not just on the actions of Jim Justice or Donald Trump or Joe Biden or whoever else. It's going to be written on the actions of each one of us. You know, Margaret Mead, who was a great scientist, you know, said that, you know, many people ask if a very small group of people who are very committed can change things. And she then finished by saying, indeed they can. And in fact, that's the only people that ever do. So I think for all of us, it's really, it comes down to our personal commitment to what we believe in and what we want to do. And no matter what the legislation is, no matter what the rules are, that if we basically decide that we're not going to comply, that this isn't important, that we don't believe this, then that's the action we're going to take. And I think that one of the issues, and I think the governor talks about this a lot, you know, he said, well, I don't have a lot else to do. Well, of course, I mean, he has tools in his tool belt still that can be used, but the tools in his tool belt now start to look at punitive measures for people not adhering to certain guidelines. And we know that doesn't work very well in real life and in simulation models to look at outcomes. So this is really a time, and particularly around the holidays, as Ayne said, with family, that we would really encourage people to start to look deep in your heart and not be so focused on whatever media portal or whoever's, you know, giving a narrative that is giving you only one lens to look through. You know, I think it's our time to really shine. And I have tremendous faith in West Virginia, and we've done well so far. But I also want to say that I'm not going to stand out in the middle of the street and start to arrest people or to criticize people who don't do whatever. This is our personal choice, but our choices impact others. And in order for us to make it through this time, it's really on each one of us. And I'm not saying that to reduce any responsibility, because, you know, I am responsible for, with Ayne and other people, for advising, giving the governor information that he needs to make decisions. He makes the decisions. He's a very informed guy. He understands what's going on. But ultimately, me as an individual, I am absolutely responsible to do my part for the bigger whole. And I hope that people do see that, because I know that a lot of people are stuck in a certain way of looking at the world or a certain narrative, but nobody's trying to take away any personal freedoms. We're just trying to call on the better angels of each person in West Virginia to take care of themselves and take care of the people they love. And if we do that effectively, we do really well through this pandemic. And that is truly the only way we do really well through this pandemic, in my opinion.
that makes sense. And there's a few other things I want to get to, but I do want to double back real quick on that, to that point, because I agree. I think if we can get people to follow the guidelines consistently, you know, on their own merit, that's always going to be better than those punitive measures. How, just quickly, how would you assess, though? Do you feel like we're having a large buy-in there? And if not, or if there's ways we can improve, what needs to be done? Because I think on a surface level, at least from what I've heard from folks, there are still a lot of people that haven't bought in, and there'll always be that. But is there anything that you think can be done to increase that buy-in, even short of punitive measures like you
I'll let Dr. Amjad take that one.
mentioned?
Well, we always hope education helps, but you know, you can't change people's minds. I mean, you hope, and it doesn't work. You think that if someone sees it in their own life or experiences, it changes it, but it doesn't. We've talked to a lot of people who know a family member who's gotten over it, who's even lost someone with COVID, but they still don't buy into it. Their personal freedom or choices. Some people just don't like to be told what to do, if you want to put it simply. And to me, I'll put it bluntly, you know, as a physician, we are taught to treat everyone equally. We are taught, no matter what the reason is, you treat them. So to me, as a health officer, I'm going to treat you and take care of you whether you believe it or not. So as Clay said, we are not going to penalize you or say anything whether you wear a mask or not. So here we are. I'm not going to try to convince someone to wear a mask or not do it. We are going to still take care of West Virginians as a whole, no matter what. So to answer you simply, Wilson, we are going to continue to educate everyone in West Virginia of what we know is safe to do. We will do everything we can to educate of what we know is going to help, of what we know is scientifically proven. But if someone has it in their mind that it is not bad, the masks do not work, I'm not going to argue with them, because as a physician, and even my personal mentality that's not how I am. And that's not how physicians as a whole are trained. We are taught to treat everybody no matter what. So that's how we operate. That's how we function. And so whether it's 50% who buy into the mask, 50% who do not, it doesn't make a difference to me personally. Even as a state health officer, we are going to do what we need to do to get the state through this. And I'm not going to argue with anybody, because at the end of the day, we're going to have to get through this, and their personal beliefs are personal beliefs. So that's my opinion in that. So we're going to educate with what we know is true and go forward and work with them, whatever their beliefs are. Because to me, it's almost like politics. I mean, I'm still friends with Democrats, Republicans, doesn't matter to me. So same thing, you're a mask wearer or not a mask wearer, I'll still be your friend. I'm still going to work with you, and I'm still going to take care of you when you walk through my ER. So
Yeah, and I would just say the only thing I might add to that comment, because I think that was really nicely said, Ayne, is that, you know, we know that as opposed to, and the governor's talked about this too, as opposed to, let's say somebody wants to jump off the bridge. We don't think that's a good idea, but that really just will harm you and maybe your family because of the loss. But if you are COVID infected, you could harm many, many, many people and not even know it. So wearing a mask is, in this setting for me, has a bigger sort of, you know, responsibility than if it's just me taking care of me, because it's like drunk driving. If I go out and drunk drive, I could hurt somebody else. If I want to hurt myself, you know, I mean, at some point we want to help people, of course, but if people decide to do that, then that is eventually their right to make those decisions, or not to take blood if they're a Jehovah's Witness. But if you don't wear a mask and you're infected with COVID-19, you can infect tens of people, hundreds of people, thousands of people even, and that has a larger responsibility to try to help people see that side of the equation. And I think that, you know, we've done well. So it's not like West Virginians haven't been trying, and we don't want to say, oh, people are not good. This is a very difficult time. We're tired. People are tired of not seeing each other, tired of not going out, tired of not going to football games, tired of whatever, that the restrictions might give them the mindset that they are somehow being, you know, inhibited from enjoying their personal liberties. And I would just say this is an extraordinary time that calls for extraordinary responsibility from all of us. And if we can mount that responsibility, as we have done well so far, then we will do well through this. But as Dr. Amjad said, no matter what happens in West Virginia, we're all in to do everything we can to help West Virginia and each citizen do as well as we can possibly contribute to. And it doesn't have any inclusion on belief systems or actions. You're here, we want to help you.
And I appreciate your all's efforts and sort of your willingness to work with all West Virginians in that. I think just, and then I'll move forward because we've got a couple different areas to discuss. But I think as a private citizen, you know, looking at it, one of the things that I've heard, and just personally, I think looking at, there have been a lot of West Virginians that have done well and have really taken these guidelines to heart. I think it's sometimes hard to fathom the resistance because we see this high cost, we see that we're on track for 1,000 or more West Virginians dead by the end of the year. And I think that really, it weighs on people because exactly like you said, there are, repercussions far beyond just ourselves. And I think when folks call for restrictions, sometimes they're looking at it as, but there are repercussions for drunk driving, and there's repercussions for, and so it's a difficult decision. I definitely see where y'all are coming
Let me just say one more thing. I think it's funny. So Hoppy Kirchville wrote a piece this morning on Metro News, and he shared it with me. And one of the issues is, ironically, the more we don't wear masks, the more likely we'll have other mitigation measures that are governor based, So it's kind of like the opposite, because the more we are able to take care of the problem ourselves, the less that anybody, I mean, nobody wants any new laws or rules or restrictions, absolutely not. But the governor's also reading 30, 40 names, every other day about people who are dying, and we're seeing our hospitals start to fill up. So at some point, if it gets to be enough of a crisis, of course, more things will be put on the table, but we can reduce the likelihood that anything gets done just by acting, responsibly individually. So I think it's kind of an irony that not wearing masks actually may drive the things that most people don't want to see more than if you wear a mask.
Mm-hmm. Absolutely. I want to hone in on schools here for a second. And this is a really interesting question that I actually, somebody was discussing with me just the other day. We've seen a lot of countries, and I know this came up in the press conference yesterday, Dr. Fauci's comments about schools, and we've heard some from y'all about how schools can be a fairly safe place if the measures that need to be taken are in place. I'm wondering, I definitely can see where there's danger in schools. I wonder though about, is there merit to targeted interventions that look at, infection rate and percent positivity beyond just schools? And we talked, and yesterday targeted shutdowns were alluded to as a possible strategy, but is that, something that has merit? Because it does seem like there's areas where spread is happening a lot more frequently than schools, but that's what the map touches on.
Do you want me to start, or you want to start?
You can start.
Okay.
Thanks.
So I think that, Wilson, and you're a coach and a teacher as well, is that right?
Coach and a counselor, yeah.
Coach and a counselor. Okay. So the bottom line is you would have a very bird's eye view of what I'm going to talk about. And I don't have this bird's eye view. So you correct me if you want. One thing that's been more clear to me every day is that maintaining the balance of all interests in complex environments is really hard, really hard. And I would say that our teachers and the folks that are working with our kids, they're part of our hero group for sure. And we've talked about healthcare, et cetera. And I think that there's just an article that came out that basically said that with virtual learning, reading was generally okay, but mathematics kids are falling behind, and particularly underrepresented minorities, kids that come from more poverty based on, socioeconomic status, et cetera, tend to do particularly worse in those areas. And we are worried because for a lot of the services and the structure and the food and particularly our younger kids really rely on school, rely on having assessment for their mental health, their physical health. And yet at the same time, teachers feel, very vulnerable being in these kind of situations, because we know, say, for instance, in a hospital setting with the appropriate personal protective equipment, that spread in the hospital setting, taking care of patients, is actually pretty rare. And the spread in classrooms between teachers and students is also pretty rare, given that people are doing the right precautions. And the younger the kids are, at least by national standards, and we're looking at our own data, but elementary school kids are much less likely to spread than, say, more adult-sized kids. And that may be because their airways are not big enough. They can't generate as many droplets or aerosols. So that's that super spreader concept that we've talked about. But kids, even though they have virus in their nose, don't seem to spread, young kids as well as older kids. And so it might be that looking at younger kids and teaching preschool, daycare, elementary school may be different than middle school, high school as kids get bigger. We don't know that absolutely. But Tony Fauci, I think, said appropriately that we want our kids not to fall behind. But that also then impinges upon the liberties and the freedoms and the well-being of our teachers. So balancing that is really, really hard. And, you know, I think that looking at and I know you've been really very much on this thread for a while, but, you know, and I don't want to go back through a long explanation because I know you want to get to a couple other things and I'm going to have to go here in just a bit, but when we started to do the percent positive rate with the incidence rate or the infection rate, that we did that so that we would test more people. Because when we just did the incidence rate, or what we call the infection rate here, then people found out that the more new positive people you identified, the worse your rate got. And therefore, the only way not to find as many new positive people is just to test less. And our testing went to the floor, went down to less than 3,000 tests a day. We are up about 10, 12,000 tests a day now. And the more you test, the better idea you have of those people that have disease, that we don't have symptoms yet, et cetera, that we can identify to try to keep this, you know, fire from just exploding all over the state. At the same time, we anticipate that the infection rate initially will go up as we test more because we'll identify more people are positive. But if we get a really good handle on disease, eventually that incidence rate or infection rate starts coming back down. We're not seeing it come back down now. So we know that testing alone is not going to be enough to control the spread of COVID-19 in West Virginia. I mean, I think we've seen that in our, you know, as a state, we're in the red on the infection rate. I think, you know, all but about 9 counties, or maybe even less, maybe 6 counties have infection rates less than 25. One county, Mineral County, I think had an infection rate of 200 last weekend, you know, new people per 7-day rolling average per 100,000. 8 counties over 75, 26 counties, I believe, over 50. I mean, so we are seeing spread. And the question is what to do with those data. And I think that, you know, the potential to apply that in different ways, either to look at specific things that we might do for those counties to reduce that spread, to look at how we, you know, are approaching different businesses, school, et cetera. I mean, all those things the governor is very well aware of. But I think, Wilson, the thing the governor knows, and I would say I'm convinced this is true too. I'm not just saying this because I'm on these press briefs or we're talking on a recorded thing that you're doing. The single most important thing for us to do as a state is not fracture down the middle. If we fracture down the middle, then we're toast. And the more you have one side of the state's people fighting the other side of the state's people, fighting the government, to the bottom state. He owns businesses in the southern. He's been a very successful business guy. He is, you know, been in Charleston for a long time, talks to a lot of people. He's been here in life, so he gets the state. And I have a absolute, complete confidence that he understands this state better than I do by a lot. And so whatever he decides to keep the state together, I'm in on. Just the same thing we talked about. And the governor and I generally agree on most things. There's some things that he thinks different than me, and that's cool. He's the CEO, I'm not. But we've never had a single episode of me saying, oh, well, that's wrong, because the key is he understands the different lenses to wear. And what I would encourage other people in the state to recognize that he may not be doing things that you think, oh, we need to do this, we need to mitigate, we need to shut all this down, whatever. He is absolutely understands that very well. I will guarantee you, understands very well. but he also understands that he can't lose the citizens of the state. And so he's trying his best to balance that. And that is an eternally very difficult equation to keep in balance. And I think what you see is he'll adjust over time as things go a certain direction. And I have complete faith that his heart is to help people in West Virginia, to help their health, number one, save lives, but also maintain the economic foundation. You know, a lot of small business owners, you know, they'll be bankrupt. I mean, they can't stand to have another shutdown because their business is sitting on a very thin edge. And he knows that too. So I'm not making excuses, but what I'm saying is, as we go forward, how we use all this data, and we all are seeing the same picture, I guarantee you, the governor sees it too, but how he understands the state and the state's people and decides to move forward, I think is a very nuanced and a very sophisticated approach that I think he's done an amazing job of. And I've seen the you know, front stage, backstage, just like Ayne has. We see the whole thing. And there is a lot of thought that goes into everything that happens. And I think it's easy to armchair quarterback, and it's hard to be sitting in the seat. So I give him a lot of credit because I think that he's done really an extraordinary job. And I am apolitical as much as I possibly can be. I'm registered independent. So I'm not even, you know, registered to a party, because to me, I will say what I think. And if I couldn't say what I think, then I wouldn't be on the team because it wouldn't be worth it.
Absolutely. I know we're butting up on time here, so I'm going to just throw a couple rapid fire questions, just in a few sentences. If you could answer these, I think could be helpful. First of all, start with some good news. We know that vaccine is coming. I know I've been perusing a little bit of research with that, and it seems like there are some potential side effects. And I know people are concerned about some of those maybe one-day things. I think there's a lot that gets blown out of proportion there. What should people know about this vaccine, and why should they trust it?
Well, they should know that it's been tested to be about 95% safe, that it's going to likely not be available to the public till the spring of 21. It's going to go likely to hospitals, nursing home residents first, so they have time to digest all the educational material that's coming out. A lot of educational material will come out prior to then, so they have time to learn about it, educate it beforehand, and that things wouldn't be pushed out to the public unless it was safe. So I would give people time to educate, learn about it, and be informed properly, just like any other vaccine. So they have time to learn and educate about it first, instead of, you know, getting too excited and worried about it right now, because there's time to educate about it.
Right. Next question, I'll just ask real quick then, unless there's anything you wanted to add there, Dr. Marsh. With schools, oh, you can go ahead. Go ahead.
No, I say I had nothing else to add.
Perfect. With schools, do you, when you look at that picture, and I know a lot of counties are doing different things, and we've been big on local choice. I know a lot of counties that have moved back to that 5-day close to full capacity model. Is there an increase in sort of danger of infection depending on how you do this thing, or are there different ways to crack this egg?
Oh, I'll start on this, although Ayne in many ways is more expert than I am, works closely with Dr. Emily Oster, who's at Brown University, who's really become an expert in this. But I think, Wilson, the key is that, you know, the more people are in their masks and physically distanced to the level they can, and minding those mitigation strategies, and particularly as we can continue to have good airflow in the rooms that people are in, then the risk of developing and spreading COVID-19, particularly, as I said, with younger children, is really pretty low. And when we look at the outbreaks, which are basically, I think, was it 2 to 3 cases, Ayne, in schools that is defined as an outbreak? Then schools have a number of outbreaks. But when you look at the number of people that are infecting each other, schools are really, really low. So the spread that we see is really between teachers or staff at, you between older children, kids, young adults on sports teams or in bus garages or whatever, between people where they're interacting with each other. The transmission between young people, students, and teachers are really restricted, as I understand it, to pretty rare circumstances like special education, where people may not be wearing masks very readily, or where there's been previous relationships between people, like somebody's mom's a teacher and she got infected and one of the children did, and they spread it to somebody else. I mean, so that there's these kind of dyads or triads. But ultimately, we believe from the data that being in school is safe, but we also need to be very sensitive to the fact that many teachers may not feel it's safe at all. And, and people are saying, well, what do I do to eat? What do I do to take a break? What do I do to get my mask off? And the answer is, there's not great answers to that. We really suggest that people should eat separately, that they shouldn't take their mask off around each other, that if you can be outside or have really good ventilation and be physically distanced in any areas where people are around each other, that's so much better. And just like for students, I think that one idea might be creating kind of pods of teachers, so that if you're going to be around other people, restrict your environment to a few constant people you're around, because then if your little cohort gets infected, it doesn't then require the entire school, the entire teaching staff to be quarantined. Mm-hmm. So I think that there are a lot of caveats. But I think the key is, just like you talked about vaccines, and we could go, talk to or green in the face or whatever the governor says, about how safe this is or that is, or what this data is or that data is. But the truth is, when you personally are in an environment that you don't feel safe in, then you don't feel safe. And I think that for us, it's really a matter of being also really, really sensitive to what the teachers need to be able to feel safe in class, just like we will talk a lot about what the students need. So that'd be my thoughts.
Absolutely. The biggest concern, one of the biggest areas of concern that I've heard about, you mentioned it sort of, is when the kids eat lunch. Because oftentimes there's distancing, but you've got 100, 200, 300 people in a room. But those are good suggestions. I think cohorting is something that can be useful, especially at the elementary level. It's a little harder with staffing at the high school level and the way schedules work. But
I would just say, I'm a personal believer that there may well be differences between elementary age children and older, larger, adult-sized age children. And that may be something that we will start to become much more focused on, particularly during the winter months. I don't know that for sure, but I think if you look nationally and if you talk to Dr. Oster, then she sees some of the same data. Ayne, you might want to comment on that.
No, I agree. I mean, we've been looking at that if it's safer for, say, K through 8 to be in school, separating them, and then maybe high school age children, because they are more active socially and, maneuvering around. But, kids eating in the classroom rather than in lunchrooms, cohorting, as Clay mentioned, and things like that. But we do, have to be sensitive how people feel, as well. But it is important how you act socially as well, not just wearing masks in school, but how you conduct your personal life as well, because that's where transmission occurs. So you can wear masks while you're in school, even at work, but then if you socialize on the weekends, not wearing masks, you can transmit that in the school system or at work. Any of us can do that. So those things are important to remember in any profession as well.
Yeah, this has been fantastic. I don't want to take up more than one other question of your time, and it's a feel-good one. What would you say has given you the most hope in the midst of this situation in West Virginia? As you've gone through, y'all have had a chance to really look at this state through quite the lens. What's been the biggest inspiration or the biggest hope for you?
Oh, it's the people, 100%. I have incredible faith in the goodness of the people in our state. And although, we're people that are pretty independent minded, and, we will take care of each other. We will serve, we will do the right thing. And so I have no questions that is not only happening and happened, but will happen in the future. And just like everybody else, sometimes it takes us a little getting there to get there. But I am so thankful for being part of this. You know, it's such a privilege to serve, but it's also great to see the hearts of people in our state for each other. And that is something that I have absolute confidence in.
I would echo that. I still am very proud of how West Virginia is compared to the rest of the country. I don't think people realize how good we are doing compared to the rest of the country. You know, I read how people are frustrated, but if you look at us comparatively, considering we are probably one of the worst states when it comes to every other economic healthcare statistic in this country, we have done really, really well with our resources. And as far as our team goes, not just with the team we work with inherently, but across the state, we have people who are so committed to this pandemic, who work very, very hard with really great attitudes. It's amazing. And so, you know, I just hope that people of West Virginia can, you know, continue to feel that way, because we've done really well. And I don't think people realize that.
Yeah. Well, I just want to say I appreciate both of you. I know that might not always come across on Twitter, but the work that you do really has saved lives, and it makes a tremendous difference for our state. So I'm very thankful for that, and thankful for your willingness to do interviews like this. So, yeah, appreciate you joining us, and let us know if there's anything we can do to support, certainly as the people of the state. So
Thank you, Wilson. You be well.
you too.
Wear your mask.
Oh, you bet.
Thanks.
Bye. Bye.